Clots in the lungs can cause chest pain. Clots in the arms or legs may cause pain and swelling. Clots that lodge themselves in the brain can cause visual disturbances, weakness, and speech impairment, all symptoms of a stroke. Blood clots can either remain in place or break off and move through the body's circulatory system, the highway that brings needed nutrients to our organs and then carries away waste products.
The blood obviously flowing through the circulatory system is supposed to flow very freely. A blood clot occurring in any one of those blood vessels, whether it's in an artery or in a vein, is going to stop blood flowing where it needs to go. A heart attack would be a blocked artery, so the downstream heart muscle can't get oxygen. And a stroke is a blocked artery in our brain, where our brain gets deprived of oxygen.
I want you to walk on it like a tightrope, heel to toe.
Though Philip Strubig's symptoms were slowly becoming evident, in the end, he didn't sense the seriousness of his condition. However, his wife Jo responded quickly once she discovered his problem with disorientation. Like the symptoms of other medical conditions, even stroke symptoms can be rationalized to the point of not taking appropriate action in time. But, like the early warning signs of a heart attack, ignoring the body's signals that a stroke may be underway can potentially lead to a devastating conclusion.
Since you're here, I'm going to check the special clotting studies, which they should have done if they didn't do it. I'm going to recheck your B12 and see whether it's high, low, or normal.
You don't know what I'm at B12 right now until we take the test.
I just know that it was low end of normal last year.
Oh.
And we're going to recheck it now and we'll see. Time is of the essence when we talk about acute stroke. The saying among neurology and the medical community is that time is brain. And that's true because we know that there is a very limited window of opportunity that lasts just a few hours for us to intervene and reverse the effects of a stroke if someone's having an acute stroke.
Because time is brain when it comes to treating stroke, it's extremely important to know its typical symptoms. These include the sudden onset of weakness, numbness, or perhaps even paralysis on one side of the body, typically affecting the face, arm, and leg. A sudden difficulty in talking or having trouble understanding what people are saying are also important symptoms, as are the rapid onset of double vision, an inability to walk, or a sudden severe headache.
Well, any of the warning symptoms of a stroke could be an indication that a stroke is occurring or that a larger stroke may occur in the next few minutes, hours, or days. So we tell people to take these warning symptoms of a stroke seriously, pick up the phone, call 911, and get to the nearest hospital that's capable of diagnosing and treating people with a stroke as soon as possible.
One of the most common and important risk factors for stroke is high blood pressure. High blood pressure usually occurs silently and has little or no symptom we can observe. That's why everyone should have their blood pressure checked regularly.
But there are other important risk factors for stroke. These include diabetes, high cholesterol, smoking, obesity, eating an unhealthy diet, as well as alcohol or drug abuse. All of these are risk factors for stroke.
Many stroke patients are prescribed antithrombotic therapy, more commonly known as blood thinners. These medications don't actually thin the blood, but keep it from clotting further. Treating a stroke depends on the type of stroke that has occurred. If it's an ischemic stroke caused by a blood clot, patients are often given tissue plasminogen activator, or TPA. TPA dissolves the clot and restores blood flow to the brain. Though TPA carries a risk of bleeding in the brain, its benefits clearly outweigh the risks when used properly. TPA is effective only if given promptly, usually within the first 3 hours after onset of stroke symptoms.
In some cases, though, the patient needs surgery because they may have a bleeding stroke, and in which case a neurosurgeon has to go into the brain, stop the bleeding, and remove the blood clot.
If the problem is due to a blocked carotid artery in the neck, surgery, called carotid endarterectomy, might be used to remove the accumulated plaque. Endovascular therapy is another technique in which angioplasty balloons, stents, and coils are used to treat some types of problems with the brain's blood vessels. For many stroke patients, antithrombotic therapy is often prescribed to keep the blood from forming more blood clots. Patients are likely to be placed on this therapy in the hospital and then continue its use temporarily or indefinitely after going home. When these therapies are used, however, creating the right thinness or thickness of the blood is an important and sometimes delicate balance to achieve.
And any pains in your legs when you walk, cramping pains?
No.
Okay, good.
And there are a variety of anticoagulation drugs, and each of them have their own potential sets of problems.
Peter Angood is Vice President and Chief Safety Officer for the Joint Commission, an organization whose mission is to improve care and safety practices of healthcare organizations.
The main issue with anticoagulation overall, though, is making sure that the patient's clotting is not interfered too much. The blood's not too thin, if you will.
Again, anticoagulation therapy is designed to reduce the blood's ability to coagulate.
On the other hand, while that is very vital, if you over anticoagulate, you can also be at risk for bleeding. So there's a balance that has to be struck so that it's in harmony. Check your blood pressure.
This delicate balance is crucial for patients who need to be on anticoagulation therapy. Of course, patients who have had a stroke caused by a brain hemorrhage are not prescribed anticoagulation therapy. Again, some stroke patients are often treated with a blood clot dissolver called TPA as an initial step. For patients who need anticoagulation, heparin is often given either through an IV or subcutaneously by a needle placed just under the skin. If the need for anticoagulation therapy goes beyond a hospital stay, patients will likely be prescribed the anticoagulation drug warfarin. Warfarin is taken by mouth and is the therapy most prescribed for patients as they begin to make the transition from the hospital setting to their homes.
I think it was in 5 or 6 days, and they let me go home. I was put on a few drugs at that point in time, at which point they actually gave my wife syringes, and you had to be given shots in your stomach.
Shelley Powell lives in Chicago with her husband Barry. She has been on anticoagulation therapy for over 20 years. Shelley did not experience a stroke, but had other issues that her doctors needed to address as a way to prevent stroke and other consequences caused by blood clots.
I have a lifelong story. I was born with a defective aortic valve, which my parents were told about in the hospital when I was first born. Fortunately for me, I did not have any problem with it for many years.
Although Shelley has never been diagnosed with a blood clot, dealing with her defective aortic valve eventually led to her lifelong need for treatments to fight clotting.
After I had my second child and I was 35, I started noticing increasing symptoms. I'd get short of breath, I would get very tired walking, up a half a flight of stairs, and it started limiting my activities a lot. I had my first valve surgery in June of 1986, and at that time I was started on anticoagulation because of the valve, and I've been on it ever since.
Doctors prescribe precise amounts of anticoagulation therapy for the specific needs of each patient based on periodic lab tests. But even then, doctors say there are things that can alter the effects of the medication based on a patient's diet and the interaction of other medications they may take. Patients should discuss those carefully with their healthcare team. Next up, we'll learn about some of the latest options in the treatment of stroke, including certified treatment centers and something called telestroke. We'll also see how Shelley Powell has adjusted to her ongoing use of anticoagulation therapies, and visit with Philip Strubig, who made the transition from stroke victim to stroke survivor.